Good evening and welcome to everyone. My name's Andy Hassel. I'm head of the School of Medicine here at Keele. And it's my enormous pleasure and privilege to welcome Manuel Dayrit, who since 2013 has been Dean of Ateneo's School of Medicine and Public Health in Manila. And I really mean it is a privilege to welcome him. A tiny little bit, I know, Manila, you're going to tell us about your career, but a tiny little bit from my perspective. So Manuel qualified in 1976 in medicine from the University of Philippines, although I think that was your second degree, if I'm right. And he's had a very distinguished career as a leader in public health for decades, and then more latterly also as a leader in medical education. Just some of the things that he has done. He was Secretary of State for Health in the Philippines from 2000 to 2005. He then became Director of Human Resources for Health for the WHO from 2005 to 2012. And then he decided to take things easy and took on the Deanship of Ateneo School of Medicine and Public Health, which I have to say was a new school. So all the challenges of a new school, which we're familiar with at Keele. My personal contact, I think, goes back only about 18 months, and we've developed two projects with which we're both involved. And I thought I'd just give you a little bit of insight into the projects, not lengthy, but some idea, as that's what brought us together to start off with. The first project is called iPrime, and it is a project which is about developing a curriculum for physicians to train to deliver primary care in a particular province of the Philippines called Northern Samar, which is a very rural province. And there are some particular challenges about the delivery of healthcare there, which you can imagine some of those challenges. And this is about what do primary care physicians need in their training, how can they be helped, how can they be enabled. And so we've been doing that together. And then a second project, which is led by Lisa Dicamitis, who's sitting at the front here, and also by Joel, who I've lost. There we are, by Joel, is an ethnographic study of the perceptions of health and of healthcare in that same rural province in Northern Samar. And it has been hugely exciting for us to be involved with these projects. I must say, as with all of these sort of global health projects, I'm in no doubt that we gain far more than we contribute. It really helps enhance our understanding of global health. I feel extremely optimistic that our students, particularly our medical students, but also other students, will benefit from this, and that in years to come there will be an exchange programme, hopefully within that rural province. So that was how we first met. The only other thing to say is I've got three observations about Manuel. I hope it's not too presumptuous to make my observations. So the first is one of social responsibility. As a university and as a medical school, we aspire to social responsibility. I have met no one else who espouses social responsibility in their everyday fibre as much as Manuel Dayrit does. And I'm sure it will be apparent when you give your talk, but it is incredibly impressive to meet someone who lives this, whose actions and who's made key decisions in his life, who clearly could have had success in many areas of life, but chose an area which is in some ways less sexy, in some ways more challenging than many other facets of medicine where you could certainly earn much more money, has made a huge success and is leading other people in that direction. So social responsibility would be my dominant observation. My second one that I'd like to make is again, I find fairly humbling, but it's your openness to new ideas. I've got three examples of that. The first example is the programme, the medical school programme at Ateneo, which, as I said, is a young programme. It's roughly the same age as the Keele medical programme. But they have done what I think is a fairly unique achievement at Ateneo in having a combined degree, which is an MD and an MBA. So their graduates graduate with both. And I think there's huge foresight in doing that because it recognises the sorts of skills that healthcare professionals need and that doctors need, particularly as it happens for this kind of practice that we're talking about in these rural areas of the Philippines. But of course, many doctors in the UK would say they feel they need the same skills, particularly, I think, doctors in primary care in the UK. So that's one innovation. A second is Manuel's response to ethnography. And you said today, we had a super presentation today by Joel, and Manuel said the only problem is, why weren't we involved in this years ago? And I think that to have reached this stage and still be embracing completely new concepts from different disciplines because they can enhance the well-being of the population, I think speaks of someone who's very open to new ideas. And I see that as well. Again, I'm sorry to embarrass you and to embarrass some of the younger members of the audience here, but Manuel's interactions with junior members of his team, extremely open to their suggestions, extremely welcoming. And I dearly hope I can take a page from his book in that respect. So I think that openness to new ideas, that welcoming them, embracing them, a second key observation I'd make. And then the final observation I have to report to you, because I feel you'd expect it from me, is a third quality, and I can only call it star quality. So Manuel has star quality, and this was really brought home. I mentioned the two projects, partly so that you'd understand the context. So within this development of primary care in northern Samar, we visited. And the visitors from the UK were Christian Mallon, Tom Shepherd, Lisa Digamitis and myself. And we were treated superbly by our hosts, led by Manuel. And we went to a number of rural health units. And I've got to say, these rural health units are very remote. And they're substantially run by volunteers, a significant proportion of which I think it's fair to say are female. And we were clearly in the presence of a star as we went round. And as soon as we arrived, I have to say they flocked round, and it was very, very, again, inspiring to see someone who could so engage instantly with that audience of people who are in remote communities, with little material wealth, with a commitment to healthcare, who absolutely Manuel got. And I would say that there was that star quality in the mix there, because they clearly, the photographs are great. And of course, we all shared in that, didn't we? But it was very much reflected glory that we got. So that would be the third thing, star quality. So without further ado, Manuel, I'd like to welcome you, and we're really looking forward to hearing what you have to say.
Thank you very much, Andy, for that very generous introduction. I have a PowerPoint presentation. This topic that you'll see the title of, and I think it's up there, I've been thinking about it for a long time because it's quite a complex topic to try to explain my personal development, but also link it up with social developments in the country. So really, for you, who probably don't know very much from the Philippines, you're going to learn something about the development of the country over the last 50 years. But you'd have to see that also from the point of view of one person, myself, who was swept through those social developments and actually ended up the way I am. I guess very, very simply, it's a story about change. It's a story about change in our society, but it's also a story of change in one person. And therefore, even the title was selected in that sort of way, the transformation of the society and of the person. It's not about reform, in a sense, reforming from bad to good. It's really the way things evolved personally. And this will be a story that will be told to you in pictures. And you'll see what I mean, that I will try to juxtapose social developments with my own personal developments. And there are going to be three parts to this talk. The first part will sort of chronicle the events personally, over the last 40 to 50 years. And then the second part will look at specific themes. One specific theme will be the internal aspects or the interior aspects of my personal transformation. The second theme will be my own experience as Secretary or Minister of Health. And for that theme, you're going to see talks about mythology and how I tried to link mythology with the labors of Hercules and the work that we did in the department. But actually, I'll explain later that that mythology works in quite a number of ways to explain what we were trying to do. And finally, I'm going to talk about, in a sense, the public persona that I had to take on to be the leader in certain organizations that I actually led. Because this is quite important, because I'm not a natural extrovert. I'm actually a compensated introvert that had to deal with the rigors of having to work publicly with large organizations and with the public. So as I said, this is about change. And when I say change, I mean it in two ways. That I made a change with people, but also that I was transformed and I was acted upon. Personal experiences and social context. Thank you to Jello for this. This is a double helix. And as the pictures emerge, on your left side will essentially be the personal transformations that I underwent. And on the right side, the social events that transpired during that time. So let's begin with part one. And take a look at that. Well, I had a very happy childhood. I was born and raised in Manila during the tranquil days of the 1950s. You see, I was born in December 1950. So I'm 67 years old. I was the eldest of 8 children. I had a middle-class upbringing. My parents were both professionals who valued education. And if you can see this, these are my parents. They've both passed away. But my father was a physician and clinical pharmacologist. My mother was a pharmacist. Now, we came from a big family of 8 children, and I was the eldest of that. My father was an eminent, I might say, physician and scientist. And this is a picture of him receiving an award from the Ateneo for the work that he had done. And we all gathered on stage to honor him. This is a picture of the larger family, just to give you an idea of how large our family was. Okay? And this was taken at the time when both my parents had actually passed away. And this will give you an idea of my own family, myself, my wife, Ellery, or Vera, who's here, and our 2 daughters, Sophia and Roxanne. So this is my sort of my calling card to introduce you to the family. But with that then, we'll go to my personal development. And this is the 1960s. I would call this the decade of blissful innocence. I was in high school, and at that time, the Beatles were in vogue. There was the Vietnam War. The Americans had landed on the moon. And I graduated from high school in 1967. And I would say that this was quite very blissful because I was growing up in a middle-class family, well cared for. We weren't very wealthy, but the children knew no want. And so we were very, very happy. But then, in the 1970s, society was actually changing. The 1970s, the Philippines was a social volcano. And this was the time of my actual, you might say, political conscientization and political awareness. And the pictures will show it. Because this was the year, this was the decade, when actually martial law was declared. And I'll explain that a little bit more. This was the year when student activism had actually exploded on the streets of Manila. In 1970, in fact. This was the year, this was the decade when I, as a college student, an editor of the school paper, was very nationalistic. And an English campus paper, which was published in English, we actually started to publish in Filipino. And this is a picture of a barricade on the street in front of the university. And I was actually there during that barricade. What was the context of the social unrest? Well, I'll just give you three. First, from a political point of view, this was the time when social activists were actually clamoring against US imperialism. And the very context of 2 US military bases in the country were being questioned. This was the time of the Vietnam War. And we didn't want, the social activists didn't want the US military bases in the Philippines being used for the Vietnam War. This was the time when there was a movement for agrarian reform, because many of our agrarian systems were very feudal, and many of the farmers were poor. So there was a growing concern that poverty was being perpetuated by a feudal system. And this was also the decade when the reforms of Vatican II in the Catholic Church were beginning to take root. So this was the year when, in a sense, I, in 1970, in college, made a decision to shift from a business degree to a pre-medicine degree. So one decision that led to my many transformations. Having done that, we moved then to the years when I was in medical school. And the social context when I entered medical school in 1972 was this. Martial law was in fact declared at the time of medical school. There was a huge flood in Central Luzon that we, as medical students, began to coordinate, and these are pictures of that. But as medical students, we were quite, you might say, siloed and isolated from many of these social events. I must add a little bit to backtrack that before I entered medical school, and this is an interesting point that I don't normally talk about, I was actually almost expelled from Ateneo. Because being editor of the school paper and being part of the group that was very, very active in student affairs, we organized a rally at the time, and we were then slapped with administrative charges for disrupting classes. So I went through that semester, hyperacidic. Luckily, I still made the dean's list. At the end of the semester, I faced the discipline committee. And because I'd actually been a good boy, I knocked on the door of the class and said, "Professor, would you allow your students to join the rally downstairs?" So when the discipline committee looked at that, they said, "Okay, just apologize to the dean for doing this." But anyway, can you imagine what would have happened if I had been expelled? So I went through medical school, and in medical school, I think the idealism that we had gained in college, actually persisted. And as a medical student, I was one that actually went out and got exposed to many of the rural areas very, very early on, as early as first year, all throughout to fourth year. And when we graduated in 1976, I guess I was ready to leave Manila. And so that was the second decision, to leave Manila soon after medical school and go and work in Mindanao. And so that went through the next phase of, you might say, my career. I went to Mindanao, which at the time, you must remember, this was the time of martial law. Those that worked in the rural areas of Mindanao were either government, but that was the Marcos government, church, or members of the leftist underground, or you might say other related groups. But the left was certainly organizing there. Working there, I must admit, I was influenced by the left as early as college. And it was here, I guess, that I was testing out the theories of the left. Because the left, essentially, and we were borrowing the ideology of Mao, which is Marxism, Leninism, and Mao Zedong, and the idea of social transformation through violent overthrow of the government. But you have to understand also that the social context there was a mix. There were people that were actually very extreme left and communists, but there were people that were working with the church who were sympathetic to the communist cause, but were not totally sold on violent overthrow. There were those that were working with liberation theology as actually the basis for many for their social activism. So this was the period when I then decided to forego a medical residency in Manila. I would have taken internal medicine, and decided to work in the rural areas. So essentially, my work there was some clinical work, but it was really social organizing. Health programs on top of social development programs. And these are pictures of the areas that we would go to. You'd come down the highway, you'd walk 2 or 3 kilometers to the interior, and you'd reach a village. And this is a picture of some of the people we were working with. We were working with nuns. These are the barangay or community health workers we were training then. And much of the training there was really basic health care, connecting health care with ordinary life, connecting ordinary life with, you might say, people's understanding of how they get sick. This is another set of slides that shows what we were doing. This is my wife, and she's right there. And we're training health workers to identify tuberculosis patients. And this was at the time when 4-course chemotherapy was just being brought in. This was 1977. And we were working with a Dutch NGO who was providing us with the drugs. This is an example of us teaching barangay or community health workers, what to listen for in the lungs. This is an interesting picture of delivering a baby right in a hut. And this is, again, my wife. Of course, I'm taking the picture. And he was a health worker, and this was his wife. And these are pictures of the children in the community. This person, for example, was a community health worker. She had many children, and at 40, she was still having kids. This is a picture of the leader of that community. He was a farmer, but he was also a lay leader, a church leader. And at that time, there were no priests that could go to these villages to say Mass on Sundays. So what would happen would be people like him, who were trained by the church, would conduct Sunday liturgy, which meant they'd read the gospel readings, reflect on them, and they'd give communion. They'd get the communion from the parish, maybe the day before, and eventually distribute communion here. These were very formative years of my own training. And this was the time when I would say I had to divest myself of all of the thoughts of superiority because I had gone through university. This was the part where I learned that as a community organizer, you begin with where the people are. And you learn from what they have and what they can teach you. Because here, we learned about their problems. A farming community, we learned about rat infestation. There was a time that the community got together to actually beat all of the rats into a huge mound of clay and just literally beat them. And after that, you had hundreds of dead rats, field rats, and of course, we ate them. This was the type of, I'm looking at Lisa, because I said, we were doing ethnographic research at the time. And my only regret was we weren't as rigorous. But really, we were experiencing what the people were undergoing so that we could provide them with better care. But the other thing also was that we were trying to link them up with the formal health services, even if they were anti-Marcos government. Marcos government. We'd work with the midwives who had the supplies to immunize the children. So I did that for, as you can see, 77 to 84. And by this time, I decided I'm going to be a public health person. And there was an interlude during this period when I went to London with my wife. And we were lucky to get scholarships. This is a picture of us in the student lodging where we were. I went to the London School of Hygiene and Tropical Medicine and did an MSc on community health in developing countries. And my wife, Ellery, went to the Institute of Child Health. And this was, in a sense, our basic academic foundation for the work that we were going to do. But what happened then, as you can see, during this time when we came back, shortly we went back to Mindanao, but shortly after that time, EDSA 1 happened. And I think you know what EDSA 1 is. That was the huge population uprising, very, very peaceful, that led to the ouster of President Marcos. So by that time, we had moved from Mindanao. We had gone back to Manila. And because of my studies in London School and the fact that, I guess, working in the community had, in a sense, exhausted me, my career took a scientific turn. And I joined the Research Institute. And this is a picture of me being an epidemiologist, researcher, working with our bosses at the Research Institute for Tropical Medicine in Manila, collecting samples from Lake Laguna. to look at etiologic agents for diarrhea. So from community organizing, I moved into the scientific tract and did that for about 3 years. Until, as you can see, 84 to 87, again, things changed and I got into the Department of Health in the central office. Now that was the Central Department of Health. And this is a picture of Secretary Bengson, who was then the minister. And Secretary Bengson, by the way, was he was minister. When he left, he then went back to the private sector, and many years later founded the Ateneo School of Medicine and Public Health. So you can see how the cast of characters actually begin to sort of come together. But these are pictures. One of the main things that I did then in the central department was, because of my training also, was to set up an epidemic control service. Soon after I had done my London studies, a project came about where we wanted to strengthen epidemic control capacity in the department, and I became the lead person for that. So over the next 10 years, from 1987 to 1997, among other things, I would be going to Atlanta, the Centers for Disease Control, to actually attend conferences on epidemic control. So if you wanted to just pigeonhole me as what did you do in public health, it was that. It was to create a team of field epidemiologists to do epidemic control for the country. And we trained quite a number, so that we had epidemiologists in all of the 13 regions and as many of the provinces and cities of the country. Now, the other things that were happening here were this. One of the social reforms that Secretary Bengson spawned would be the Generics Act, where medicines are expensive in the Philippines because at the time they were sold as branded medicines, and multinational corporations kept the prices very high. And therefore, legislation was passed to require the use of generic names in the prescribing and the dispensing of medicines, a way of increasing competition for medical products. Another thing that happened at the time in 1992 was the devolution of the public health services. Now, this was one of the, you might say, earth-shaking legislations that eventually changed the face of the public health organization of the Philippines. And of course, I think in 1991, I don't know if you see, this is a volcanic cloud. That was the time when Mount Pinatubo erupted in 1991. And our field epidemiologists were right there, working in the municipalities that had been affected by the volcano. So from there, what happened in 1997, there was a huge scandal in the department. The Minister of Health, and I was now Assistant Secretary, the Minister of Health got embroiled, this was not Bengson, got embroiled in a corruption scandal. As a result of the investigations, the senior management of the department had to go and face the legislature and the investigators, the Blue Ribbon Committee, the Health Committee. And so, as part of senior management, I had to go through that. Of course, I had nothing to do with the scandal nor the corruption, but this totally burnt me out. So by 1997, I've said, time to move on. So I left government, and in 1997, I joined, the private sector. So what I did then was I first joined an American HMO and learned more about private insurance. It was a very frustrating job for me because private HMOs are there to cut, to provide services, but to cut them at a certain ceiling. You can't, exceed what you paid for in your insurance policy. So I only stayed there for a year. And then I joined a pharmaceutical company where I learned more about how pharmaceutical companies operated, from the production of medicines to the distribution, to the marketing, and so on and so forth. Again, on the social scene, another upheaval. The president of the country at that time was impeached. And so his vice president took over. And when that vice president took over, she changed the cabinet. And because she had been brought in on a broad political spectrum of support, I unexpectedly was nominated from a short list and got appointed. So in 2001, after my stint in the private sector, here I am having an oath-taking with the president of the country. And this was the period of my being Minister of Health. What can I say about this? There's no other job like it. And the reason I say that is because you become the face of the organization, particularly in our society that's very personalistic. I was in charge of a central bureaucracy of about 70,000 people, spread all over the country. I had to work with local governments which had now been devolved, the mayors and the governors. I had to make sure that the programs of the central government were actually being implemented. I had to make sure that the bureaucracy was free from corruption. I had to deal with the media. I had to deal with the public. And these are pictures of that. One of the things that I had to do was to reinvent myself. I told you that I was quite introverted. And when I took on the job in 2001, one of the previous undersecretaries under Bengson said, "You look too much like a college boy, and your English is too Ateneo. You have to speak differently. You have to mix your English with your Filipino, or maybe even speak straight Filipino. You shouldn't go off wearing barongs all the time because they're associated with traditional politicians." And therefore, I began to develop a public persona, which was wearing blue denims. So every time I went out on TV, particularly since we were doing our own in-house advertisements for health promotion, I would come out with blue denims. And it's, in a sense, that became my trademark. But you can see some of the things, and I will explain them in part 3. You can see some of the things that I had to do there. This is a measles immunization campaign where I was injecting a child with measles vaccine. Now, this is my wife again, Elvira. Okay? You have to understand that when I then took over, I had to launch a campaign like this. You have to think about the bureaucracy behind it. And so we had to make sure that the bureaucracy was running. Now, Elvira then was a regional director. And I guess one of the personal costs for having become minister was that Elvira herself had to step aside. Because I think one of the things that, in a sense, we wanted to prevent was even any whiff that the relationship, this conjugal relationship of the minister and the director was being used for private gain. And so that was one of the costs that we had to deal with. This is a picture of SARS. And one of the biggest challenges I had as health secretary at the time was managing and controlling SARS. And we were able to do that so well that the ratings of the department went up 15, 20% as a result of the way SARS was managed. But we were lucky. We had 14 cases, 2 deaths, compared to what was happening in Hong Kong, in Vietnam, and in Canada. So moving on, when I left the department in 2005, and that's me leaving. I came in a private car that I drove. The day that I left, I brought the private car and drove off. And then was invited to join WHO in Geneva, where I became Director of Human Resources for Health. And this is just one of those pictures of myself during the World Health Assembly, seated beside the Director General. I'm the secretary of the committee, which is really, you might say, the invisible secretariat that runs the meeting. And this is the chair, the president of the committee, Committee A, that deals with the technical issues during the World Health Assembly. I guess we were there for 7 years, and we did a lot, including for Human Resources for Health. But I might just dwell on the work that our department did, which resulted in the negotiation, in the development, and the negotiation of the WHO Code of Practice on International Recruitment of Health Personnel. I mean, if you know how international negotiations are undertaken, just preparing this document took 5 years, because we were consulting all the time. When eventually a draft was ready, it went to the World Health Assembly, Committee A, negotiated by the member states, and eventually passed in committee, and then passed in plenary. So this was passed in 2010. But I don't have my name on that. That's actually the work, that's the work of the world, of all of the member states that actually participated in crafting it. At the present now, I guess, after leaving WHO, I took on the job as the dean, and you know, I was never really an academic, but I had taught in medical school in my early years, and it seemed right to take on the job, and the school was inspirational. The pioneers of the school had set it up so that they would create a new breed of doctors that actually were social catalysts. And I said, hey, isn't that what I wanted to be? So I took on the job, and that's where I am now. But within the job, as you can see, it's resulted in creating collaborations, also with local governments. And this is the governor of Northern Samar, and some of the people. And this is the project that we now have. I think this is the picture that Andy was referring to when we went to a remote barangay of Northern Samar. We had to take the boat, and these health workers, you know, they knew me. And what was interesting was that I had left government in 2005, and this was now 2017. So this was a good 12 years. And, you know, they would have certainly have forgotten somebody who had been on TV 12 years ago. But apparently they remembered me. So I think this actually told me that whatever we did at the time actually got into the psyche of the people for them to remember. So this is just me with the ASMPH, which is what I do now. And this summarizes the chronology of my 42 years. Community organizer, and this was the formative years, the 6 personal transformations. Civil servant, because when I joined the department, the whole value of being a civil servant then got inculcated in me. Corporate servant, my short stint in the private sector, where I always thought of doing public health within the private sector. The face of DOH, as the Secretary of Health, global civil servant in WHO, and finally, formator of new leaders. Now, I must hasten to add that, all of these were, while they may be seen as an individual achievement, I always think of them as achievements that were enabled by quite a number of partnerships and collaborations. I wouldn't have been a good community organizer if, for example, my wife wasn't there, or even a good secretary. And the team of people that were working with me all the time actually were the people that were driving the accomplishments that might be attributed to me or maybe even to somebody else. And so let's go to part 2. And this is going to be shorter. But what I wanted to say here, I guess the first part there was I wanted to delve into the internal, the interior developments here. But I would say my relationship with my father, and of course with my wife. She doesn't know I'm saying this. I didn't tell her. But you see, my father was a clinician. He was an academic. He was a scientist. And he was the person that did research on virgin coconut oil in the country. But he preferred that I became a clinician. Okay? And I would only learn later because friends that he would talk to, mutual acquaintances, would tell me, oh, this is what your father said, And for example, he said, your father said, he doesn't understand what you're doing in Mindanao, I think it was him venting, But he never really influenced me to do anything. He was never prescriptive. When I shifted to medicine in college, it was my decision and he just supported it. And therefore, even when I became or was in the short list for minister, he said, I wouldn't take the job if I were you. He was the doctor of a previous minister who had prostatic cancer. And he said, my patient, he's the Secretary of Health, but he can't do much within the political environment. And look what he got, prostatic cancer. So he wasn't that supportive of that. But eventually, as I guess, my career matured, eventually I became secretary and WHO, he came around to really understanding what it was all about. Well, I don't think I would have done any of the things I could have accomplished if my wife wasn't with me. She was a year behind in medical school, and she also had applied for residency and been accepted. And I said, why don't you just come over and join me and work in Mindanao? And she did. And shortly after that, we got married and eventually even joined the Department of Health at around the same time. But I guess 2 persons that I would say were very, very instrumental and influential in any of the accomplishments that I actually achieved. I guess the second point that I want to raise, second of 2 points, were the concepts of leadership in a large organization. How do you influence 70,000 people? You can't directly supervise them. So in the end, I figured that the way you influence 70,000 people, because you're the role model, is to essentially be a role model to them. And so that role model meant being as professional as we could. And therefore, during my time, I would not be credited for establishing any innovative policy for health financing or for human resources. During my time, I concentrated on just doing the right things well. And I think those 4 years can be held up as a time when we just did the right things well. For example, we managed SARS and became an example for the management of SARS. We defeated the vaccine-derived polio by conducting 2 immunization campaigns that wiped it out. We actually established programs to put pressure, downward pressure, on the prices of medicine. And we also started the process to fund more adequately social insurance, which at the time was not being funded at all, very much. And I will show you more of that in part 3. And I guess the other thing that I want to say is, the third point, would be the public persona and the relationship with media. That and number 2, leading the bureaucracy, are inextricably linked. Because when you come out on radio, on television, your messages and your persona influence the very bureaucracy that you lead. And because the social advocacy that we did had actually projected the department so well, then the bureaucracy functioned well. And from the point of view of media, I think what I can say there was we dealt with media as partners. Particularly, for example, we made sure that the beat reporters understood why epidemics were going and what were the dynamics for high prices of medicine. It came to the point that because they were so educated by us, because the beat reporters at the time were not that well educated on health, they became adequately critical of what we did, which was good. And therefore, we had done our job in educating them. So we now go to, I guess, well, this is just, but this is me eating chicken on television because we wanted to tell people, calm down, you know, bird flu is not going to kill you. Because people had stopped eating chicken. And the suppliers were really at the mercy of this outbreak. So part 3, what I'm going to do now, and you probably like this, but in my last year as the minister, we had to make a report about the accomplishments of the department. And so this was very, very, you might say, something that we had to do. And all members of the cabinet had to do it. And I just wanted to write it in a way that it was interesting. And so what I did was I said, because my children were still small, and they had been watching Walt Disney cartoons, and there was Hercules. And I said, why don't I craft a report to make an analogy with the 12 labors of Hercules? Okay? So what I will show you are the 12 labors of Hercules, which are really the labors of the Department of Health. But really, upon reflection, the labors that I put there were labors that I personally undertook also through the course of my career. So it's a good summary for that. Let's begin. First labor. If you remember Hercules, killing the lion of Nemea. And does it work? Okay. Killing the lion of Nemea, and this was fighting SARS. And we did very well, as you can see. This is a front page ad when we were declared SARS-free. Second labor, this I like, because this is what we did in terms of control. Killing the 9-headed hydra. If you know the mythology, you cut off one head, 2 heads grow. And essentially, this was controlling all of the diseases. Polio, TB, malaria. This is what we did, including, for example, micronutrient nutritional programs and so on and so forth. So that was our second labor. The third labor, as you can see, I talked about this, was cutting the drug prices through different methods. And one of them was encouraging the generic manufacturers to produce quality drugs. Another was actually continuing parallel importation of a few drugs just to demonstrate that the prices from India were far, far cheaper than the prices in the country. But you can see here, it's capturing the boar of Mount Erymanthus, I guess capturing cheap medicines and making available half-price medicines in the country, which we were partly successful at. The fourth labor, overcoming the Cretan bull, which is half monster, half bull, but this was the labor of expanding health insurance for indigents. By this time, they had passed a law that PhilHealth or social insurance had to be expanded, but there was no money to cover the premiums. So the president actually led the way there and put $3 billion in the pot to cover premiums, particularly for indigent populations. The fifth labor, very, very controversial, one of the most controversial in our country. But the president, when she stepped in, said, the policy is promote natural family planning. There was a huge outcry from many groups that said, why are you not promoting artificial methods? But this was the policy that we implemented. We did not prevent people from using artificial methods. We just didn't promote them actively as much. And this is a picture of the Speaker of the House providing funding to advocate for natural family planning. The sixth labor, bringing back the girdle of Hippolyta, this was improving the quality of health services. And a lot of this was just improving some of the facilities in the hospitals, many of which may have been run down. The seventh labor, one of the iconic labors, was cleaning up the Aegean stables, cleaning up against corruption. And we were quite successful here because I would say that, if you take a bribe as a minister, you think it can be kept secret. Never. It's actually the person that gave you the bribe who's going to say, yeah, he takes a bribe. And eventually, everybody will know that you took a bribe. So, just by keeping your nose clean, being a role model will do the job. The eighth labor, and this is with rounding up the mayors of Diomedes, because this was the huge undertaking that we needed to do to make the bureaucracy efficient and effective. And that meant getting the directors, the assistant secretaries, rank and file to do what they do. Ninth labor, interestingly, this eventually was the job that I took in Geneva. But this was developing human resources to deal with our health problems. And it was like bringing back the golden apples of Hesperides. The golden apples were these trained health workers that you wanted to mobilize for the country. 10th labor, managing the devolved health system. You see, when the health system was devolved, there were 75 provinces and over 1,000 municipalities that all now were responsible for the health services. And central government could only deal with them as partners. You could not dictate on them anymore. The 11th labor, harnessing foreign assistance at the time, because we were still considered a very, very poor country. Now no longer. Foreign assistance is not that large anymore. And in fact, the budget of DOH is largely domestically funded. And finally, the 12th labor, revitalizing health research. So if you look at all of those labors, I had somehow been involved in all of them at one time or the other. And these were the labors that we reported in our final report as my term ended. So I would simply say that in the end, as a health professional, my passion has always been to improve health in the country. Alma Ata was actually signed in 1978, and the slogan for that was Health for All. We're now in 2018. The buzzword is universal health care. It's the same. It's Health for All. And I guess we come full circle. I guess I might say that working with young people who see the vision for improving health in the country is actually a great fulfillment and a great pleasure. So I will end with this slide. This is a slide from an excerpt. You've heard of Dr. Jose Rizal, who was our national hero. He was actually a physician. And the Spanish eventually, shot him for being a revolutionary. But he wrote a novel entitled El Filibusterismo, the filibuster. And this is a statement given by one of his characters in the novel. One character, Simon, right, was telling Basilio, who was a young doctor, right, and this was the time during the revolution against Spain. But he was saying, someday you will perhaps be a great physician if they let you go your way in peace. But greater yet will be he who can inject a new idea into this anemic people. You, what are you doing for the land that gave you existence, that supports your life, that affords you knowledge? Don't you realize that it is a useless life which is not consecrated to a great idea? This saying was actually one of the sayings that we put in our yearbook when we graduated from medical school. So in a sense, it's nice to go back to it, over 40 years later, to see that, we've been true to our ideals. We continue to be dedicated to a great idea, and hopefully we can work with others to do the same. Thank you all very much.